There are many diseases and illnesses that affect the elderly. Alzheimer's, cancer, heart disease, strokes, and the list continues on. One particular disease that isn't quite as commonly known is Parkinson's disease. According to the National Parkinson Foundation, NPF, there are estimated to be 60,000 new cases of Parkinson's disease every year. This number is added to the 1.5 million of Americans who are diagnosed with the disease and the 7 million worldwide. Parkinson's is a neurodegenerative brain disorder that progresses slowly in most cases. The symptoms can take years to develop, and individuals can live for years with the disease. This disease causes the individual's brain to stop producing a neurotransmitter called dopamine. With the lack of dopamine, the individual has less and less ability to regulate their movements, body, and emotions. Parkinson's itself is not fatal. However, the complications caused from the disease are quite serious. The Center for Disease Control and Prevention rated complications from Parkinson's as the 14th top cause of death in the United States. Parkinson's disease symptoms and signs may vary from person to person. Symptoms usually begin on one side of the body and usually remain worse on the side even after the symptoms begin to affect both sides. Early signs may be mild and can go unnoticed for years. Here are some major symptoms that can signal the start of Parkinson's. Tremors. A tremor or shaking often begins in a limb, often your hand or fingers. You may notice a back and forth rubbing of your thumb and forefinger. One common characteristic of Parkinson's is a tremor of your hand when it's relaxed. Tremors may worsen when the individual is stressed or excited. Slowed movement. Over time, Parkinson's may reduce your ability to move and slow your movement, making simple tasks time-consuming and difficult. Your steps may become shorter when you walk, and you may drag your feet. This forms a shuffling motion and can cause you to trip and stumble when walking. Rigid muscles. Muscle stiffness may occur in any part of your body. The stiff muscles can limit your range of motion and cause pain and soreness. Impaired posture and balance. Your posture may become stooped, or you may have balance issues as a result of Parkinson's disease. Speech changes. You may have speech problems as a result of Parkinson's disease. You may speak softly, quickly, slur, or hesitate before talking. Your speech may be more monotone rather than the usual inflections. Writing changes. It may become hard to write, and your writing may appear small due to the tremors. Although the major symptoms are physical, the damage done to the brain and muscles can cause secondary symptoms. These secondary symptoms may include depression, memory loss, anxiety, dementia, or slurred speech. There is currently no treatment to cure Parkinson's disease. There are therapy options to help reduce the physical symptoms by increasing the amount of dopamine in the brain. This can be done by replacing the dopamine, mimicking dopamine, or prolonging the effect of dopamine by reducing the breakdown. The most effective medication for Parkinson's is levodopa, which is converted to dopamine in the brain. It is a long-term treatment with unpleasant side effects, such as shortened response to the doses, painful cramps, and involuntary movements. For individuals with unmanageable motor symptoms, surgery may be an option. During deep brain surgery, a surgeon will implant electrodes to stimulate the brain area involved with movement. During DBS therapy, a small pacemaker-like device sends electronic signals to an area in the brain that controls movement. These signals block some of the brain messages that cause frustrating and disabling motor symptoms. The device is placed under the skin in the chest, then very thin wires are implanted in the brain to enable the signals to reach the source of your symptoms. Another alternative approach that's been experimented with is getting dopamine-producing cells from stem cells. Although stem cell therapy has great potential, there hasn't been enough research on the treatment yet. In addition to medications and surgeries, general lifestyle changes need to be made along with physical therapy, occupational therapy, and speech therapy. The National Institute of Health found that Parkinson's affects 50% more men than women. Although the disease affects all ethnicities, Caucasians have a slightly higher risk. It typically affects individuals over the age of 60, but some can get it as early as 30. It's been found that only 5 to 10% of patients with Parkinson's have had family with the disease as well. This means 90% of those affected have no family history of the disease. Exposure to specific toxins can increase your risk, but very rarely are the cause of Parkinson's. There have yet to be any preventive measures found for Parkinson's disease. Multiple studies have linked exercise to lower risk of Parkinson's, but this hasn't had enough research to be reliable.